Good morning. This is Michelle Smith. I'm with Texas Action for Healthy Kids. I'm the state coordinator, and we'd like to welcome you to our second session for Partnering for Healthy Kids, the Texas Education Agency update on new legislation, and talk a little bit about their TEKs review process. So the logistics are, you can listen in with your telephone or use your computer speakers. Everyone will be muted except for the presenters. You do have a question box where you can submit questions, and we will either answer those at the end, or if it's appropriate, we will talk about it during the session. We are recording this webinar, and it will be posted. We will send out a link for you and any other information, a PDF file of the slides as well. So let's get started. Just a little bit about who we are. Action for Healthy Kids has been around since the early 2000s, working on obesity issues in schools. When Dr. David Satcher declared there was an obesity epidemic, one of the ways that it was felt would be most beneficial to work on obesity is to help our children learn to live healthier lives. So Action for Healthy Kids has worked very hard with schools to improve the school wellness environment and hope that we can help children be healthy, active, and ready to learn. Here in Texas, we have a really strong team and have worked in various ways. We've been very involved legislatively. We've provided grants for breakfast as well as recess, physical activity, other types of initiatives. We've helped provide school health advisory council trainings. We host at least an annual summit. Sometimes we will even have two. We do webinars like this one today, and we have done training around wellness policies. We also promote Every Kid Healthy Week in the spring, where we hope that all schools will take a little bit of time to do something that is healthy. So we're excited to be here today. We have over 5,000 members across the state, and we have a very strong steering committee made up of all the organizations that you see here on this screen. So right now, I'm going to turn this over to Barney Fudge, who is the Texas Education Agency Health and PE Coordinator, and he will share information on the update on the legislation as well as TEKs. So Barney?
Good morning, ladies and gentlemen. It's Barney Fudge with TEA. Hope everybody's doing well this week, and hopefully wherever you are, you're experiencing some fall-like conditions, because we have experienced them here in Texas and they've gone away, and summer has decided to return, but then fall comes back again tonight. So we're on a roller coaster ride. Michelle, if you go ahead and advance to the agenda. Today, what I'm going to do is provide some updates on bills that were signed into law that impact school health during the 86th Texas Legislative Session, and then also provide some information about the Texas Central Knowledge and Skills Update, affectionately referred to as TEKs. Next slide, please. So for the 86th Texas Legislature, next slide, Michelle, we have House Bill 18, and House Bill 18 was a big mental health bill that became effective September 1, 2019, and throughout these slides, some of these bills were very large in size, and so trying to get all of the information into one slide or even several slides is a daunting task. And so at the end of the presentation, I'm going to show you where you can go and look up the information on the Texas Legislature online. So all you would need for that is the bill number, but I'll go over that towards the end of the presentation. So what House Bill 18 does, it is that it has training requirements regarding mental health of public school students that have been added for certain school employees. There are curriculum requirements now for health education that it has to specify the inclusion of both physical health and mental health. There were some requirements for counseling programs that were amended. there are additional requirements for coordinated school health programs now to focus on mental health. And then TEA, in cooperation with Health and Human Services, must develop guidelines for districts regarding partnering with local mental health authorities and other community partners to increase student access to mental health services and provide information about obtaining mental health services through medical assistance programs. And then there's also some reporting requirements regarding local mental health authorities and school district personnel that were adjusted as well. And I believe a lot of the information contained in House Bill 18 is being handled through our mental health area, which is in a complete different location than I am in. And the contact for that would be Julie Wayman is who the contact for that is. Next slide, Michelle. House Bill 76 is cardiac assessments. This was a bill that had been filed for, I think, pretty much every legislative session that I've been here at the agency, and finally this year it was signed into law. And what that does is that the district must provide a student who's required under UIL rule and policy to receive a physical examination before being allowed to participate in any UIL activities. And they also have to provide information about sudden cardiac arrest and electrocardiogram testing, notification of the option for the student to request the administration of that electrocardiogram, in addition to their physical to be able to play athletics. And then they may request that from any appropriate licensed healthcare professional. And then the UIL was given the authority to adopt rules to administer that section. So all of that resides within Health and Safety Code, Chapter 38, but it's really UIL's responsibility legislatively. House Bill 496, which is a rather big bill that I've received a lot of information about. So House Bill 496 is basically says, number one, every district in the state's got to have a protocol for employees and volunteers to follow in the event of a traumatic injury. And then it lists what that protocol must consist of. And one of those is ensuring that bleeding control stations are stored in easily accessible areas of the campus that are selected by the district school health and safety security committee or the district's governing body. Next slide, Michelle. The protocol must also require that there's agency-approved training on the use of a bleeding control station in the event of an injury, and that training's got to be provided to each commissioned school district peace officer, security personnel officer, or school resource officer that provides security services or law enforcement services at the campus, and then all other district or school personnel who may be reasonably expected to use a bleeding control station. And then it also requires the district or charter school to annually offer that instruction from a school resource officer or other appropriate person that's been trained to students enrolled at the campus in grade 7 or higher. In addition to this, there was a call for programs that was put out several weeks ago, and those programs, I believe, had to be submitted. The deadline was September 27th, and a review of programs has been completed, and there were 2 programs that were approved. One is the American College of Surgeons Stop the Bleed program, which is predominantly 90% of what everybody uses here in the state of Texas. And then the other was from a organization out of the San Antonio area called Contingency, and it's called Bleeding Control Basics, and it's kind of based on the combat casualty care model that the military uses. So those are 2 programs that are approved, and I will show you at the end of the presentation where to go to locate that information for those programs. Next slide, Michelle. So House Bill 684 talks about caring for students with seizure disorders and training requirements for school personnel. So it basically states that the parent or guardian of a student with a seizure disorder may seek care for the student's seizures while the student is at school participating in school activities by submitting to the district information about the student or a copy of their seizure management plan from their practitioner. Next slide, Michelle. And then it also requires school nurse and staff and district employees to complete an online training or online approved course of instruction. And there is a call for programs that either, I don't think it posted last Friday, so I think it will post this Friday, but there's a call for programs that has gone out for anybody that has a online course of instruction for school nurses as well as district employees that meets the requirements that are listed here in the statute. They can submit that for approval to the agency, and the statute requires that we have those programs posted by December 1st. So got a little bit of time, but not much. Next slide, Michelle. Says that TEA can approve an online course of instruction provided by a nonprofit foundation that supports the welfare of individuals with epilepsy and seizure disorders. And it's got to be approved by the agency and provided to a school district by the nonprofit entity free of charge. And we're required to adopt rules as necessary to administer the requirements. So there will be some additional work done on that as well for developing rules to administer that section. Next slide, Michelle. So House Bill 961, basically concussion oversight teams have been on the books for several years now. And what this bill basically did now is add school nurses to that concussion oversight team. So if a district or open enrollment charter school employs a school nurse, the nurse may be a member of that concussion oversight team. And the nurses have been added as to the list of individuals who are required to remove a student from practice or competition if they're suspected to have sustained a concussion or if they appear concussed. And then the school nurse is also required to complete the required training for that as well. So that's all that House Bill 961 does. Next slide, Michelle. House Bill 2243 talks about use of asthma medication on public and private school campuses. So basically, this has been in law and on the books for public schools, for public schools and charter schools. Now it's adding those same statutory requirements to private schools now. That's basically what that one does. Next slide. House Bill 3884. In previous years, in Chapter 38, the Texas Education Agency is required to disseminate bacterial meningitis information to school districts. And this bill basically changes that duty from TEA to now it's requiring the Texas Department of State Health and Human Services to issue that information. Next slide, Michelle. Senate Bill 435 basically talks about school health advisory councils and opioid addiction and abuse education in schools. So what it does is that it requires the school health advisory council to determine the appropriate grade levels and curriculum for instruction regarding opioid addiction and abuse and methods of administering an opioid antagonist are added to the list of topics for the school, for the SHAC to make those recommendations to the Board of Trustees. Next slide, Michelle. Senate Bill 2151 talks about the Texas Diabetes Council and the State Plan for Diabetes. And the current law requires the Texas Diabetes Council in consultation with DSHS to develop and make available materials to provide information to be distributed to students and parents. And this law adds the requirement that DSHS must consult with the Texas Education Agency before developing and making those materials available. Next slide, Michelle. And this is the main page for the Texas Legislature online, and it's capitol.texas.gov. You can see the web link there in the bottom. And so what you would do is you're going to go to that web page, and then in that little search bar right there under bill, so you'd make sure that you have 86R 2019 selected. Then you will click the button for bill number, and then you would type in whatever bill we've discussed, House Bill 496 or Senate Bill, House Bill 18, one of those numbers, and then you would hit go. Next slide, Michelle. And then that's going to take you to information about that bill. And you're going to want to make sure that you click on the text tab, and you're going to go all the way down, and you want to make sure that you're clicking on the enrolled version. That is, when it says enrolled version, that's the version that has been signed into law. So you want to make sure that you're reading from or working from that enrolled version. Next slide, Michelle. Yeah, and then right there, circle the enrolled version. The next slide after that, I think, is where the circle comes up. Next slide, Michelle. And that takes us to the Texas Essential Knowledge and Skills update, but I wanted to kind of take a brief stop right there to see if anybody had any questions about the information that was covered.
I'm not seeing any questions just yet, so be sure and type your questions in if you have any, and we'll definitely get them answered.
All right, so the Texas Essential Knowledge and Skills, or TEKs update. Next slide, Michelle. So TEKs review is currently underway for health education as well as physical education. And the State Board of Education has the authority for the review and the revision of the TEKs. And the SBOE, with the direct participation of educators, parents, business, and industry representatives, employers, adopt the revisions to the TEKs. And typically it takes, one or more subject areas a year is what the SBOE takes on. Currently, right now, we're doing health and PE at the same time, as well as wrapping up oh my gosh, I can't even think of it right now. Right now, we have 3 going on at one time, which is a daunting task within itself, and we're also fixing to begin science. So ELPS, that's it. So we have health education, physical education. The review of English language proficiency standards is, I believe, in its final stages and is wrapping up. And then we're fixing to begin science. So lots of busy times ahead here at the agency. Never a dull moment when that comes up. And the review and revision of the process takes between 1 to 2 years, and that's an estimate because it depends on multiple things there, but it typically takes about 1 to 2 years, probably more 2 years than anything else, when you have to add in the meetings, the revisions, the public comment, and those kinds of things. And that 2-year process, that also includes the SBOE rulemaking process, which can extend over 3 board meetings. And we'll kind of talk about that process here in a minute. Next slide, Michelle. So the health education and physical education TEKs were initially adopted in 1998 and haven't been revised since that time. So like I said, the full review and revision of the TEKs for health and PE is currently underway, and we will begin our work group B meeting in 2 weeks. We've already had work group A, and so we're on to work group B here in a couple of weeks. Next slide, Michelle. So the process for review and revision includes multiple opportunities for public input. I'll go over that more here in a minute. And then updates regarding the review process and the opportunities to provide feedback will be provided throughout the whole entire process from beginning to the end, and information about the review and any documents that are posted and those kinds of things will be sent out in the Health and Physical Education newsletter. Next slide, Michelle. So here's kind of a quick overview of the process. You have the initial steps by TEA, the State Board, and Regional Education Service Centers. Then the content advisors provide feedback, and the SBOE determines, makes determinations and approvals, and the work groups begin. And that's where we are right now in the process. We're actually at item number 4 there, where the work groups begin working on what their charge is. Then we take feedback from the content advisors and ESCs over the work that's been done by the work groups, and then SBOE discusses it. We have our final work group meetings to finalize anything that's been provided feedback and adjustments that need to be made, and then the rulemaking process. Next slide, Michelle. So this is a snippet of the document. This document can be found on the TEKs review and revision webpage, and I'll show you where you can locate this document in a minute. It's a large document that goes over the entire process. And so right now, next slide, Michelle, we're going to talk about the initial steps by TEA, the SBOE, and the ESCs. Next slide. So the initial steps, and again, these are things that have already taken place. TEA collects information via survey. We had a survey that was posted for several weeks for health education as well as physical education that collected information has been provided to the State Board as well as the work groups that are working on the TEKs. So that step in the process has already been done. And then we conduct a briefing for interested stakeholders to review opportunities and the processes. I believe that meeting was held in June this past summer. And then the ESCs coordinate and collect regional feedback on the TEKs, and that has already happened as well. Next slide. So then our content advisors review the current TEKs and develop their initial recommendations, and then the content advisors meet for face-to-face meeting to develop consensus recommendations. And that process has already happened as well. And the content advisors convened in August of 2019 to discuss their initial feedback and develop consensus recommendations to guide the TEKs review. And those consensus recommendations are a shared statement regarding what the content advisors recommend addressing in the review. Next slide, Michelle. So then there's a work group application process. So we have an application. It's a general application, and the link to that application can be found on the Health Education Review webpage as well as the Physical Education Review webpage. And that information is posted there, and we continually collect applications throughout the whole entire review process. So if you know of anybody that's interested in participating in the reviews, especially high school PE teachers, we need some high school PE teachers. We're running a little thin on high school PE teachers. So if you know anybody, or if you yourself want to apply to be on those, you would go to those respective content pages on the TEKs review webpage and then fill out that application. And the SBOE members approve those applicants, and then TEA sends the applications to the SBOE to review and approve them throughout the process. And then TEA builds work groups based on whatever the charge is for that work group at that time. Next slide, Michelle. And then the next one. So now we're going to talk about the work group meetings themselves. Next slide. So the TEKs review and revision work groups, TEA convenes the work groups to address specific charges related to the revision of the TEKs. They typically meet for a 2-day, day and a half to a 2-day face-to-face meeting virtually, and virtually as needed. If we don't finish the work at the face-to-face, then we will conduct a webinar to ensure that we've completed the charge. And then additional work groups are convened on as needed and consist of a combination of new and returning members. So for example, with work group A, half of the members from work group A have been invited to participate in work group B. So then you have a mixture of work group A members with new work group B members. And that's a new part of the TEKs review process that we're experiencing this year. And with work group A, they met in September, and the work group was charged with expanding on the framework that was recommended by the health education content advisors and their consensus recommendations. And the work group also was charged with identifying where student expectations from the current TEKs for health education would fit in the proposed framework. The work group A for health completed its review of the student expectations for kindergarten, and the next work group, which is work group B, will complete the remaining grade level and courses at this next work group B review that's coming up. And the physical education work group A completed their student expectations through K through 12, and we'll have a different charge moving forward. Next slide, Michelle. So TEA posts each work group's drafts to the TEA website, and all of the drafts and work group information for work group A for health and PE should be posted sometime this week. Probably toward the end of the week is when that information will be posted. And then ESCs will also coordinate and collect regional feedback on the drafts that are posted. And then the content advisors will review the drafts of the TEKs and provide written feedback to the SBOE regarding any additional work that needs to be done. Next slide, Michelle. And then the next one after that. So now what we're going to talk about, what we're going to talk about is the SBOE meetings themselves. Next slide, Michelle. And I believe we should be on slide 31. So for the final recommendations, the work groups are made. So the final recommendations from our work groups are made, and the SBOE will provide additional direction or feedback to the work groups. And then TEA convenes the final work group consisting of members from previous work groups. So it would be all work groups members, are selected. Some folks are selected from A, B, C to participate in D. And then the work group finalizes the recommendations for the revisions to the TEKs, and then the content advisors will make a final review and provide any written feedback to the SBOE. Next slide, Michelle. And then the SBOE will hold public hearing and take action on the proposed changes to the TEKs at first reading. So we'll have TA collects basically public comments for 30 days. So we'll collect comments on the proposed revisions, and then that information is given to the state board. And then the content advisors will provide any additional recommendations for revisions to the TEKs based on the feedback that we've received. And then the SBOE will take action on the proposed changes to the TEKs at the second reading and final adoption. So you have first reading where it's provide content, and then adjustments are made based on that first reading, and then at second reading and final adoption is when the final versions are adopted. Next slide, Michelle. The proposed timeline, and again, this is a proposed timeline, and note all dates and times are tentative and subject to change because there may be something that comes up that kind of throws us off our timeline. But the surveys were out in the spring, summer, so we got started late summer with the review. 2019-20, the TEKs will be adopted. Summer of 2021, the instructional materials will be reviewed, because you can't review instructional materials until you've had your new TEKs adopted by the board. So once those are adopted, then that gives textbook folks the opportunity to produce new material that's in alignment with the TEKs. And then the 2022-2023 school year, the revised TEKs and instructional materials will be implemented. And again, that's tentative because it's always subject to change. And then the TEKs review and revision web pages. That's the link there for the health education TEKs review web page, and then the physical education TEKs review web page is right below that. So those are the web pages where each of the content for those respective reviews and the work that the work groups have done will be posted on those pages. And to get there, you would just hover your cursor on the TEA. You go to tea.texas.gov, and you would hover your cursor over academics, and then once you've done that, then you would click on where it says Texas Essential Knowledge and Skills Review and Revision. And Michelle, I'm on slide 35. So you hover over academics and then click on Texas Essential Knowledge and Skills Review and Revision, and then that takes you to the main review and revision web page for the TEKs. And then you would have from there, on the next slide, Michelle shows the subject area views. So to see all the documents and everything for health, you would click on health education, and then the same for physical education. The little arrow that comes flying in there on slide 36. And then on slide 37, this is what the health education TEKs review webpage looks like. And this is where you can find the commissioner's health TEKs and study recommendations. The board gave the charge to the commissioner to conduct a study, and that link right there on slide 37 where the arrow's pointing to on the health education TEKs review webpage, you would just click on that to review what those recommendations were. And basically what those recommendations are, it's the SVOE requested that the Commissioner of Education convene an advisory committee to develop recommendations for the review of the health education TEKs. The SVOE asked that the recommendations include a study of current health education research and state standards, including national best practices that would be used as a guide for the SVOE to begin the review and revision of the health education TEKs. So that's kind of a synopsis of what that information entails there on that link. Next slide, Michelle. So again, for subject area reviews, this is the physical education work group application. So each respective content area, the health education work group application, there's a link posted there as well as one for physical education. So if you want to participate on health or physical education, you would click on the educator review committee application link there, and that would pull up the application for you to fill out your information. And then the next slide there is, do we have any questions about anything?
I do not see any questions right now.
All right, well, moving on to the next slide, there's contact information for the curriculum division. And then also, if you want to receive any bulletins, listserv bulletins, you can do that by going to the main TEA webpage and clicking on sign up for updates. And I believe that is the next slide here, slide number 41 and then 42. So sign up for updates, and you can sign up for information there. What you would do is just click on that link, sign up for updates, and it brings you to a page where you would enter your email address and select subscription type as email. And then when you hit next, it takes you to the page for you to select any and everything that the agency sends out information about. And the one that you would want to look for is health education and physical education. And there's our kind of copyright policy. And then I thank y'all for your time this morning.
Did you want to go to your website or?
Yes, ma'am. Let me, let's go ahead and do that. We'll go to the web page. Share. do I just hit yes to share?
Yes. I believe so.
Okay, so the main TEA webpage. So here's what I was talking about, where you can go to sign up for any of the listserv bulletins. So you just click sign up for updates, and then you select email, enter your email address, and then you hit submit. And then that takes you to the next page where you select whatever email distribution that you would want to receive. And then the slides that I was showing earlier for academics, so you hover over academics, then you come down to the Texas Essential Knowledge and Skills Review and Revision webpage and click on that hyperlink. And then you scroll down to subject area reviews, and then right here at the top is health education and physical education. So that's where you would go to find each of those review committees, documents and information that's been posted. And again, everything for work group A should be posted later this week. And then the last piece of information I wanted to share and show everybody is about House Bill 496 and the programs that have been approved. So, and those are posted to the Coordinated School Health Programs webpage. So you would basically just, the easiest way to do this is to hover over the A to Z index and click on that. And then you would click on the letter C for Coordinated School Health, and then scroll down for Coordinated School Health Programs and click on that link. And then that takes you to the Coordinated School Health Programs webpage. And if you scroll down, it lists the models there, the Coordinated School Health model, and you'll want to click on the Healthy and Safe School Environment link. So you click on that link, and then that takes you to the information about the bleeding control program. And again, the American College of Surgeons Stop the Bleed program, and then Contingency Consulting Bleeding Control Basics. That information is there, and those are the two programs that have been approved. Are there any other questions?
I'm not seeing any, Barney. So can you stop sharing, I guess, and it'll come back to mine.
Just clicked on it.
Okay. Are you seeing my screen?
I am not.
Well, let's see. Okay. There we go.
There we go.
That was great, Barney. That's a lot of information. I think it'll be really helpful to send the PDF file with all these slides. I think the key takeaway here is that it's not too late to have input on TEKs for health or PE. The process is ongoing and there are multiple opportunities. So be sure and take advantage of those opportunities. And we have Barney's contact information as well, which will go out with those slides. And if you have questions, you can shoot them over to Barney. Real quickly, for Action for Healthy Kids, if you have a school that you feel is doing wonderful things and needs to be recognized, you still have a little bit of time. We've extended our deadline for nominations for Healthy School Heroes. If you have an individual that has done an outstanding job of improving the school wellness environment, just check out our latest newsletter. There's a link there, or contact me and I'll be happy to send you the link. And our summit is coming up November 18th at Region 13 here in Austin. We have the board chair from ASCD is going to talk about the whole child model. We have updates from Partnership for Healthy Texas. We have breakfast panel. We have student photo voice. It's going to be a really good day, so consider joining us in Austin for that. And our next webinar is scheduled for Tuesday, November 12th. And that will be basically School Health Advisory Council 101. So if you have questions about School Health Advisory Councils or just need kind of a refresher course, that would be a great opportunity for you to get some additional information. Thank you for joining us today. Again, my name is Michelle Smith, and there is my phone number and my email. Feel free to reach out if you have any questions. Yeah.
Michelle,
I see there is a question there. I'm just checking.
Right. And so the person is asking, where do the TEKs for sex education live? Are those part of PE or health TEKs? And that we're actually waiting on some clarification. More than likely they would live with the health TEKs, but anything pertaining to human sexuality instruction right now is legislated in Texas Education Code 28.004. I think it's subsections, I through J, I think. So the state legislature has outlined specifically what human sexuality instruction should consist of, and we're waiting for clarification on if that would reside, since we're doing a revision of the TEKs for health, would some of that be in the health TEKs, or since it's already legislated by law, would it have to still be separate and kept out? So we're still trying to feel out that information and where it would live.
Interesting. So it's never, I always thought it was part of health TEKs, and it's not.
No, it's not. I mean, what's required to be taught currently is the Texas Central Knowledge and Skills for health education. You can look at the TEKs, and there are some areas where it's rather broad, so that instruction could consist of that. And again, how the TEKs are implemented and the instructional materials and the plan of action that districts use to implement the TEKs for all local district decisions. So, but yeah, that information, the shacks are by law to determine at what grade level human sexuality instruction would begin. And so that determination is made by the School Health Advisory Committee, or they make that recommendation to the board. And so that's how that is determined.
Thanks.
But the guidelines for what human sexuality instruction should consist of is in Texas Education Code 28.004, and I can't remember the specific subsections, but I believe it starts with I think G, maybe G through J, or I through J. I can't remember.
All right, thank you. Well, appreciate you joining us today for the webinar. I hope it answered some of your questions about legislation that will impact your districts and your schools, as well as the process for approving TEKs. If you have questions, you can send them to me, or you can also send them to Barney. And enjoy the fall. I hope we're going to have some cool weather soon. And we'll look for you at our next webinar.
All righty. Thanks, Michelle.
Thanks.
Take care.